Hi, good morning Claire. My name is Polly Kiley. I'm your invigilator for the OET speaking session on the 28th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Claire Mendes.
And what is your candidate number, please?
My candidate number is 237891110.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Tell me about yourself.
I am really energetic and a great communicator. Working in the medical field for 3 years helped me build confidence and taught me the importance of patient care. I have also got a track record of success. In my last role, I juggled a variety of patient loads, assisted in a charity fundraiser, and became an advocate for senior patients. Because of this, the hospital is launching a new educational program to teach nurses how to better care for elderly patients.
Describe the abilities you have in order to work as nurse practitioners.
I have the ability to listen and understand information and ideas, present it through spoken words and sentences, communicate information and ideas in speaking, so others will understand, tell when something is wrong, or is likely to go wrong. It does not involve solving the problem, only recognizing there is a problem, combining pieces of information to form general rules or conclusions, reading and understanding information, and ideas presented in writing.
How do you respond to stress?
I'm pretty good at being cool. I've learned how to manage stress by staying organized to the best of my ability. I'm the type of person that writes to-do lists every morning. It's easier for me to write things down to prevent confusion, and I have a pretty keen memory. I can prioritize well and handle several different things at once. Time management is very important. I would not say that I live a high-stress life, but a little stress does me some good. It makes me prepare more and work harder.
What is the most difficult thing you have ever done?
Having to step out of my comfort zone is difficult for me. Working the night shift, we get several intoxicated individuals. I've dealt with inappropriate men and women before. Once, I had to help a man who was too drunk to help himself. This was difficult for me, but I put my emotions aside and considered the patient and the fact that he was not in the right state of mind. I don't mind asking for help. This same man needed to be restrained a bit in order to have a CT done, so I asked help from one of the other nurses.
How well do you get along with others?
I am an easy person to get along with. I'm sure some people dislike me in some way, but I can honestly say that I've never had a big dispute with anyone before. I've been annoyed with people who slack off and cause myself or others to work hard to cover up their slack, but I have had no problem confronting them respectfully.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Claire Mendes. I am one of the registered nurses working in this community health center. How can I help you today?
Nurse, I had been referred by my GP for an ECG, since I had experienced chest pain.
All right, before proceeding further, may I know your name and age for the record, please?
Sure, nurse. My name is Polly Kiley, and I am 50 years old.
Thank you for the confirmation, Polly. How are you feeling now?
Well, nurse, at the moment I don't have any chest pain, but I am a bit anxious about ECG.
Your anxiousness is quite understandable. Can you please explain why you feel anxious about ECG? Thus, I will be able to help you out.
That sounds good, nurse. The thing is that I am a little anxious, as I have never had an ECG before, and I don't quite sure what it involves.
Thank you for sharing the reason for your anxiety, Polly. I want to assure you that ECG is not an invasive procedure, so nothing to be panicked about. Before proceeding further, I will explain what ECG is, and you will be okay with it.
That's right, nurse. You may please proceed.
Yes, Polly, ECG is a simple diagnostic technique to identify the electrical activity of your heart. First of all, you need to remove clothing from the waist up, and need to lie almost flat on the bed. Once you are settled on the bed, I can attach electrodes to arms, legs, and chest, and then that leads will be connected to an ECG recording machine, which can print graphs of your heart activity. Moreover, this procedure can be completed in a few minutes.
Okay, nurse, it sounds that the ECG procedure is a straightforward one. So I hope you will be able to look at the graph and tell me what exactly causes my chest pain.
Your thoughts are sensible. However, I am sorry to say that I am not the authoritative person to tell you about the result. Try not to worry about it. The doctor would see your ECG graphs, and after evaluation, he will explain to you all the underlying things without much delay. I hope it is clear to you?
Yes, nurse. Actually, I didn't realize that it was the doctor who would analyze the results, but I am glad that it will be done quickly.
Definitely, and thank you for your understanding, Polly. Do you have any other concerns?
Yes, nurse. I just want to know whether this ECG is painful or not.
I realize what you are going through right now. As I have mentioned before, this is not an invasive procedure. Hence, it is not painful, and also, it is a safe procedure as well. Perhaps, you can expect some possibility of slight discomfort during the removal of electrodes, which are attached to your body. Almost similar to the minor discomfort while removing a bandage.
Oh, I see.
Yes, Polly, so be relaxed. I can assure you that you will be comfortable during the procedure.
All right, it is clear for me now. Nurse, I hope that after undergoing this procedure, I can come to know what is wrong with my chest, isn't it?
Yes, of course, Polly. ECG could read your heart rate and analyze the irregularities and palpitations efficiently. This could act as an initial diagnostic test. Sometimes after the ECG, the doctor may ask you to undergo further tests to find out the exact cause of your chest pain, if required. And it is completely up to the doctor's decision, based on the requirements.
All right. I got it.
Well, Polly, before moving on to the procedure, I just want to confirm that, are you carrying any jewelry or mobile phone with you?
No, nurse, I don't wear any jewelry and don't have a phone either.
That's great. It is nothing because these things can make some false changes in your ECG diagnosis. That's why I asked you.
That's okay, nurse. No worries.
All right, Polly, now do you have any other questions to clarify?
No, nurse, I am clear about the ECG.
Good to hear that, Polly. Are you ready for the procedure?
Yes, nurse. I am ready.
That's perfect. Can you please give me the consent to start the procedure then?
Sure, nurse, you may please start the procedure.
Thank you for your consent and cooperation, Polly.
That is the end of your OET speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.